Good morning, and welcome back to Good Samaritan Facebook Live. My name is Dr. Scott Stine. I'm a family physician here in Vincennes, Indiana for the last 20 years and Chief Medical Officer of Good Samaritan Physician Network. I'd like to welcome you all back to Good Samaritan Facebook Live. I spoke with you last several weeks or so, and we're going to give you the State of the Union and update on how things are going here in Knox County and kind of some perspective on where we go from here with the COVID response. Last week we spoke a bit about reopening services. We spoke a little bit about how common the disease was in our community, and we'll go over those again today. Also like to compliment everybody on what a good job they're doing as far as social distancing and continue to maintain what we have tried to lay out over the past several weeks. All of that has been tremendously helpful. When you see things on the national news, as far as other larger population centers, it's difficult to translate that and put that all here into what we're dealing with in our local community. But we'll talk a little bit today about that and how those two systems differ and how our government is playing a role in helping to direct us. But ultimately, it's up to us locally to determine how our response is and how things are going. Just a current State of the Union as far as number of cases. There's been over 330 cases that we have tested for here that have been negative. There have been only 20 so far that have been positive. And when you do the math on that, that works out to be roughly about 6% of the people that we have tested have turned out to be positive. And that's an important number as we move forward. When we look at larger centers, and when we look at the numbers in Indiana and nationwide, a lot of those percentages are somewhere up around 18, 20, 22% of the patients tested are positive. So what our 6% number means here in Knox County is that there's very few patients within our county that have the disease. That's important when we start talking about social distancing and opening society back up and starting our businesses back up and the economics of all this, is to not be overly fearful as this all starts. Everybody ratcheted things down very quickly when we pulled the plug back early in March, as far as saying we need to maintain social distancing and businesses were shut down and people were sheltered in place. That was all very alarming, and now as we're starting to talk about the reopening of businesses, it's important to realize that we don't need to be overly fearful of this because of the small number of cases that we have locally. We have 3 inpatients as of this morning. Those inpatients came not from our local community here, but from outlying areas. We've had a number of patients that have been admitted from nursing facilities remote to our area. But the majority of the cases that actually came from our community have been tested, were diagnosed, and have recovered at home. Dr. Stewart, our county health officer, has done an excellent job and has been very vigilant about tracking all of those cases and has held them for longer than what the CDC would have initially told us, which I think has really paid great dividends in keeping the spread of the virus very minimal in our local area. I think we're all very lucky for that, and fortunately that has kept the count of the total disease very low. We've been very fortunate. The hospital has mobilized lots of resources in terms of being prepared for a flood of patients, and thankfully we've just seen a trickle of patients coming in with the disease process. I've had a lot of questions about spread of the virus within households. If somebody has it, how common is it that they spread it to their household members? And what we have seen as a result of the direct cases that we've seen here within the county is there's certainly a low likelihood that even a person within your household is going to spread that illness to you. I think we feel better about that now that we've seen several cases firsthand, and Dr. Stewart has been tracking those very carefully to watch to see just how likely it is that other family members that are in close contact with a positive within their household turn positive, and very few of those have turned positive. I've had a lot of questions also about what we're doing at the hospital as far as reopening services. We spoke last week a bit about our plan starting middle of last week to reopen elective procedures, and that has gone well. We've been very fortunate that the number of patients that have held off services have done fairly well to this point, but it's important to realize that we've had a lot of people at home that have been suffering from illnesses and waiting for procedures to be done and diagnostics to be done, and those things have started back up at the hospital. As of last Wednesday, we opened up a limited number of cases for surgeries, for elective procedures and diagnostic tests, and that will continue throughout this week. The thing that we have definitely seen that we knew was going to be an unfortunate side effect of people sheltering in place at home is a lot of people with chronic disease processes and illnesses have stayed at home as they were instructed to, and unfortunately some of their illnesses have worsened. And so we're getting to the point now where it's important to make sure that if you have been waiting at home with your diabetes, having difficulty with that, with cardiovascular problems or respiratory problems, your doctors are available to you. The hospital is available to you. We want you to come in. We don't want you to wait longer than you already have. When we were initially engaged in the first response and getting prepared, we encouraged everybody to stay home. Now that the illness has turned out to not be as prevalent in our society as we thought, it's important that we make sure that people are not at home getting sicker from their other disease processes. Our ER doctors have all told us that they have seen patients coming in much sicker from other illnesses over the course of the past few weeks than they normally would, and that's simply because patients have waited at home as long as they could before coming into the hospital. So we want to make sure people realize that from a primary care standpoint, from a specialty services standpoint, we're here, we're ready to see you. We are still conducting a large number of video visits as initial screening tools. We as physicians and the patients have found that this has turned out to be much more functional and much more convenient than what we ever had suspected it would be. And it's an excellent initial tool to make contact with your healthcare team to determine if an in-person visit is necessary or not. So please call your doctor, and if necessary, we can get you set up with some phone triage, find out if you need to be seen, get you set up with a virtual visit. Not only are our primary care doctors doing this, but also our specialty physicians are doing this as well. And if you happen to be one of those patients who has been waiting for a surgery, please get back in contact with your surgeons. We are prioritizing those patients right now to determine who goes first and who comes next, and we want to make sure that we understand just how things have gone over the course of the past several weeks, so please get in contact with us with regards to that. I've had a number of questions also with regards to getting back out into society, wearing masks, social distancing, those types of things. Are we to continue with those things? As many of you know, we're living on a border state here. Illinois has declared that they're going to keep things closed for roughly another month or so. Whether our state will follow suit, we are staying tuned to that each and every day as those announcements come out. But it's important to realize that, yes, we still want people to maintain social distancing. But if there are services that you need, please feel free to get out and circulate. It's important that to maintain yourself, your mental health, your physical well-being, we want to make sure that people are getting the resources that they need. As business owners within our community, I've had a lot of questions from people saying, well, how is this going to work as we go through this multi-phase step process to reopen society? How is that going to work? And that's still kind of in the process of being discussed. But I can tell you that the businesses that are already doing that have had a great deal of innovation in determining how they can maintain social distancing but continue to offer their services. I applaud our local restaurants who have managed to continue to offer their services and stay in business and provide us with food and thankfully morning coffee that we all need to keep things going, because without them we would all be struggling more as well. So if you are a local business owner, I would encourage you to start looking at methods that you can continue your services, maintain that social distancing. And some of those things are very simple. My wife's dental office has discussed methods for keeping patients in their car. They are then retrieved from their cars, brought in individually, and that avoids waiting room congestion. We're all doing that in our medical practices as well. We call patients in from waiting in their cars so they don't have to sit in a waiting area potentially around other individuals, and to try to maintain that social distancing. So with other businesses in town and around the county and around the nation for that matter, we will all be well served if everybody starts planning for that in the future, because as we start reopening those services, that's going to allow those things to be safer. It'll allow county health officers to approve those things to be open more easily when those plans are in place, and hopefully we can get back to normal quicker. Timeline on that, it's changing every day. As we have told you over the past 5 or 6 weeks or so, every day we have multiple meetings, we get multiple briefings, we listen up to our local and state and federal government as to what their advice is and how they are directing us. And we will continue to do that over the course of the next few weeks or so. It's difficult to translate our statistics into what the population centers are. And it's important to realize that the predictive models and things that we have spoken about have been relatively accurate as far as the large population centers have been concerned, but they don't necessarily directly translate to what we do here in our less dense population areas. And so we've been very fortunate that we have not seen a flood or an influx as we had suspected, but we know that patients will continue to come in, and as long as it continues to be as we have seen in terms of a small number of patients over a longer period of time, we have plenty of resources to take care of those patients, and we hope that the best is still coming ahead. As far as where we go, the next opening of services will be continued expanding of the numbers of patients that we see here at the hospital in terms of our procedures and our diagnostic procedures, and opening up our primary care offices and specialty offices as well. And we will continue to monitor that to see if we see a rise in the number of patients that get diagnosed with COVID as a result of opening those services up. Based on what we've seen so far, we don't anticipate that there will be a big rise in that, but we know that there will likely be a second peak. The good news is, when we look at the data from other countries and from other places that have already been through this over the course of the past several months or so, we know that generally the second peak is smaller and it's flatter and it's more gradual. And we've had a very, very, very small initial peak anyway. So I think from our society and from our population center here, I think the good news is that even if we see a bit of a resurgence over the course of the next few months, that it's going to be relatively small. And again, that's something that we know based on what we've been dealing with so far, that we can handle that population of patients. A lot of questions have come up over the course of the past few days or so also as far as treatment's concerned. If you go back 2 weeks, 3 weeks, 4 weeks or so, there were a lot of experimental things that were being tested. Early on, the question of hydroxychloroquine or Plaquenil came up as far as its utilization, when that would be appropriate, if it was helpful. And as you probably remember us talking about, we were all very cautious about introducing any of those types of therapies because there really wasn't very much good research on that. Over the course of the past week or two, we have found that the few studies that have been done with fairly large numbers of patients have showed that there really wasn't much of a benefit with use of those medications. And so at this point in time, we're really not utilizing that medication much as far as any of our patients, inpatient or outpatient. Now, there are still several other types of experimental medications that are being tested and looked at right now and researched, but again, we don't really have much solid data on that, so we're not jumping on board to utilize those until we have better information from some of our tertiary care facilities that have used those more in the real world settings. As we go over the course of the next few weeks or so, we still encourage people to do healthy activities. We want you to eat right. We want you to make sure that you are sleeping well, staying hydrated well. And then from a mental health standpoint, one thing that we realize, this has been very difficult for everyone. Everyone is under stress. Being isolated is stressful. Having limited resources is stressful. Dealing with your own medical problems, not hooked up with your own primary care team, is stressful. So we want to make sure that people are reaching out to us and to our mental health professionals here in the community if they need assistance, to let us know in any way that we can help. One of the things we also always talk about every week is testing. What's being done with testing? Is testing being expanded? Are we doing new types of testing? There's currently 2 types of testing that we are offering here. Our standard send-off test, which has been going throughout the course of the illness, which is about a 48-hour to 78-hour, 72-hour turnaround time. The majority of testing that we do within our community is that type of testing and gets sent off to Mayo Clinic. The other type of testing that's been done here locally is our rapid testing within the hospital, and that's still very limited at this point in time. That's just a few hours of turnaround time, and we're using that type of testing for our most critically ill patients and patients that are maybe limited in getting out of the hospital based on their testing status. Those tests still remain very limited and will continue to be limited over the course of the next several months. Antibody testing has become a very popular topic to ask about and determine what we're going to do with that. And quite frankly, we don't know exactly what's going to become of that. Antibody testing is becoming available in multiple locations, but how we utilize that is actually the bigger question. When we look at antibody testing, what it tells us is whether or not your body has started to form the antibodies to fight off the illness. I think that the biggest place that we're going to see benefits with that is many, many months down the line. When we look at how much of our population has developed immunity to this. As we talked about 5-6 weeks ago, the likely case is that the majority of patients who get this illness and contract the illness actually have very minimal symptoms, develop immunity all on their own, require no medical treatment, isolate themselves at home, and completely recover. And even some of the sicker patients that Dr. Stewart has been managing within our community, we've found that they fully recover on their own at home with just normal supportive care and with no medications. And we anticipate that all those patients will have antibodies to this illness as we move forward. What we will probably see utilized from a population health and epidemiological standpoint is really using those antibody tests in the future to determine how much of the population was actually infected, how much of the patient now has immunity to that, and as we move forward, determining whether vaccines become available and when they become available, who will get those vaccines. So please stay tuned as to where we're at with that, but don't go run out looking for antibody testing, because at this point in time it really doesn't tell us very much. We've had a number of questions from local employers who have had individuals who've been in the hospital or have been ill with the virus, wanting to know if antibody testing will allow their employee to come back to work sooner. That really doesn't help us in any manner in that way, because the antibody testing merely tells us that you've developed those antibodies within your bloodstream. It doesn't necessarily tell us if you're still shedding virus. So what we are doing is still following by guidelines to keep those patients isolated for long enough that we know that the likelihood of their viral shedding is minimal, and therefore the potential spread of the illness is minimal. Tiffany, any particular questions you've got coming up online this morning?
Not really. I think you've
We've
really
worn it out
covered
today.
it. Yeah. Just someone asking about when more testing would be available to test more people, and then something I've already explained about our resources. Like, are there patients from other counties being treated at Good Samaritan, and are they consuming our resources that could be used for local patients? But explaining that we are a regional hospital with 11 counties.
Yeah, and I think one of the things that early on, the resources that we had available in terms of our protective equipment, our testing equipment, our hospital facilities, our ventilators, all those types of things were really in question. We've gone past that now. We are not concerned that we are going to be completely overwhelmed as far as our ability to care for these patients. The measures that have been taken over the course of the past several weeks to change rooms in our hospital, make them negative pressure, make more ventilators available, all of that stuff has gone very well. So we are all very confident, and have been for the past several weeks, that we are fully prepared for that if more patients would come. We are a regional center, and we get lots of referrals from our surrounding counties. But even though we're getting those patients in from the surrounding areas, from nursing facilities, we are handling those patients because it's been a relatively slow trickle of patients. At any given time over the course of the past couple weeks or so, when we get our daily updates on how many inpatients we have and also on how many ventilated patients we have, that's usually 2 patients, 3 patients, 4 patients, 2 patients. And so thankfully that has not been an overwhelming number of patients from an intensive care or critical care standpoint. The other big benefit is the patients have not had to stay in the hospital as long as potentially we anticipated early on. Many of the patients that were tested that were local community members went back home in a very short period of time and recovered at home. Each day, Dr. Stewart gives us an update on how our local community patients are recovering, and has given an update nearly every day stating that those patients are recovering very well at home and have needed minimal intervention as far as keeping them healthy. The surrounding areas that we have, the larger population centers in terms of Evansville and Terre Haute, have also done very well as far as resource management. One challenge continues to always be protective equipment, but there have been a lot of things that have been improvised and lots of resources that have been brought in to keep us up to date on those and keep our patients protected and also keep our employees protected. We thank all the people from our community who have donated those resources. There have been a number of businesses around our community who have donated those. We're very thankful for all of that, because that keeps us safe, and then as us being safe, we're able to take care of you better.
There's a couple of questions regarding reopening services, like how soon until ENT offices are open, because allergy sufferers are struggling, and of course mammography, questions about that.
Sure. So really just within the next several days or so, we anticipate more of those screening and diagnostic studies to open back up. As a person who does screening colonoscopies, I understand that my patients who may want to come in and get screened for colon cancer are eager to get back on the list and get those procedures started back up again. However, the patients that we have that need the diagnostic version of those tests need to come first. Those people who are having abdominal pain and other symptoms need to be seen, and that needs to be facilitated first. Similarly, patients who have diagnostic mammographic needs, those need to be taken care of first as well. Thankfully, we do not anticipate that this is going to take very long for those services to ramp back up. So really over the next few days or so, as we continue to see success in opening up these elective services and procedures, we anticipate continuing to open those up even more. Right now, each day we have a set number of cases that are set to be done as far as surgeries are concerned. Those are going to be expanding every day, and each week we have meetings to talk about how those numbers are looking. We're very much in alignment with what our surrounding hospitals are doing as well, and so what we hope is, as we continue to open those up, as long as we don't see a resurgence of a number of patients developing COVID or the spread of the disease, we'll continue to open those services back up. A couple of the terms that have come along with this illness is escalation and de-escalation. And so as we are de-escalating the response to this, we're always prepared that if we start to see more patients coming in with the illness, that we can ramp back up those restrictions. But for right now, we're very encouraged by the fact that we're seeing success in that. And for all of those of you that have been patient and waiting for those procedures, they're coming. We're trying to prioritize those all right now. So again, I would encourage you, everybody, get in touch with your primary care doctors and your surgeons to determine how soon you need to get in to get those services offered.
Now, what about large companies like Toyota reopening? Are you concerned about that?
We're a bit concerned about that, but the thing that I take solace in is in the fact that the percentage of positives that we have had has been so very low. So keeping in mind when we see the national news and when we see the state news, we're flooded by statistics, and the media likes to publish those because it's dramatic. But when we look at all of the other things in society that affect us in terms of the number of people killed in car crashes every day and the number of people that die from tobacco use and things such as that, the fact of the matter is we're not shown those statistics every day. We in medicine realize the impact of all those things, but the media has us so focused right now on all of the numbers of deaths and the number of positive patients. What they don't really tell you is how many of those positive patients contracted the illness, were tested, and have recovered at home with no difficulty. The good news is a lot of our workforce is very healthy, and they really don't have a lot of medical problems. So I think it's important to realize that as we start opening services back up and factories start opening back up and so forth, we'll continue to monitor all those very closely. And there are strategies being put in place as far as temperature monitoring and social distancing and trying to maintain those things within those facilities to help prevent the spread of the diseases. Nationwide, there have been a number of factories that have been centers of this, but a lot of those really started out before we fully understood the penetration of the illness in those areas and societies, and there were explosions of them in small factories in certain places around the nation. So what we hope is, since the number of patients that are out there that actually have the disease is relatively low, we believe the likelihood of a second peak coming up is much less than what it was several weeks ago.
So the 20 cases in Knox County, someone asked about if any of those were actually Vincennes residents. Do we know that information?
Sure. The ones that are listed on the website right now, there's 20 current positives, and those are all Knox County residents. So it's important to realize that the ones that are reported on that are the ones that we have within our county. The numbers are a little bit confusing because when we report on the number of people that are in the hospital that are positives, those may or may not be Knox County residents. So generally the most up-to-date information is on the Indiana State Department of Health website. There's been a day or two lag with that from time to time based on when that data gets put in. But yes, those patients are local Knox County residents that live amongst us. And the important thing to realize is of all those patients that have been tested, the 20 that were listed as positives, nearly all of those patients have fully recovered and have now been through their quarantine period of 14 days after resolution of their symptoms and are now back out in society. And this is something that we have very little concern about at this point. Initially, when we would have talked about 4 or 5 weeks ago, the CDC's recommendations were not to be released any sooner than 1 week after initial symptoms started and no sooner than 72 hours of being fever-free. We've really gone beyond that. Dr. Stewart has made that 14 days after complete resolution of symptoms. So that's generally going to be nearly 21 days of quarantine and isolation for those patients. And the reason that he took that measure was in looking at some of the data that came from overseas, from other countries, what they found was that there may have still been some viral shedding and contagiousness that would occur in that period right after recovery. And so I really feel confident that the measures that were taken early on by our local health department have helped tremendously with that in keeping the number of actual local cases very low.
Okay, I think that's it.
All right. Well, thank you very much. I will continue to answer questions online today throughout the day. And I'd also like to say a special thanks to the people that put the blue ribbons out for those of us in the medical profession. It's been a difficult time over the past several weeks or so, and to see that was very encouraging. So I'd like to thank the people that were behind that. And stay safe. Have a good week.